Hey, what is up, everybody? I want to welcome you back to my YouTube channel. And we're actually going to go through a case kind of as it's unfolding in real time. And we're going to be referring back to this case quite a bit. And the reason I bring this case up is this is so interesting to me. And it's something that happens repeatedly with patients that I see. And it's nobody's fault. It just happens. And I want to kind of walk you through this case, what we're going to be doing for this patient. What the process is going to look like, and some of the symptoms that she had that made me immediately think she's got a joint issue, a muscle issue, some type of TMJD type issue, and a bite issue just in general that's causing her to lose a lot of her tooth structure, which is not good. We don't want that, right? So we're in the business of trying to save tooth structure, not lose it. And as you guys know, as I go through some of these cases, what I like to do is go through the actual scans that we have so I can show you what I'm seeing and kind of let you into my world a little bit. So I can show you the symptoms that we look for, what we are trying to avoid, and things that patients may say to me that I immediately know something's not quite right here. Okay, so what I want to do is actually go through this case together. And as I'm looking at this patient's right side, and I look at the patient's left side, I immediately know this patient has had a lot of dentistry done. In fact, she's had ortho multiple times, and she's also had numerous implants, crowns, root canals, you name it, she's had it. And that immediately gets my attention if I see multiple implants, especially on back teeth. And the reason that the teeth needed implants to begin with, or the space needed an implant, is that the tooth had a root canal, crown, it breaks. There was nothing left of the tooth. Those symptoms, and when I see that happen to a tooth, I'm immediately thinking there could be a bite issue here that we need to address. And so when I actually look at her top teeth, we're going to count the number of implants together just from the scan, because this patient has implants that have an access hole on the top, so you can actually see that. So let's look at her top teeth. We'll see that she has an implant here. She has an implant here, and she has crowns on her back teeth, okay? So the teeth that don't have implants in the back have crowns on the back. That's an immediate red flag to me because it's generally restorative. These crowns are not all done at the same time for cosmetic reasons. They are functional reasons and teeth breaking one after another, okay? If we look at the bottom teeth, you'll notice that she has one, I believe that's an implant. And I'm just going from the scan. I'm not even using radiographs. One here, one here, one here. So at a minimum, she has 3 implants on the bottom, and she has multiple crowns on the back teeth that are not implant supported, right? So natural teeth with crowns on top of them. Now, what's interesting is that she has one of the telltale signs that I see a lot that dentists get baffled by, and it's because we weren't trained to look for this at all. My implant hurts. Now, what you have to understand if you're a patient is that when you say my implant hurts, implants don't have nerves. They don't have a ligament that is necessarily around the implant itself, so it doesn't move in space. It's actually fused to the bone. And so when somebody says my implant hurts, that is immediately telling me something is not in balance on this patient's bite, because an implant should not hurt, right? And when an implant does hurt, typically what somebody will say is like, well, how is that possible? It doesn't even have a nerve. It shouldn't hurt. See it a lot, that if an implant is not loaded properly or the bite is off for whatever reason, all of a sudden, the implant starts to bother you. So if we look at these intensities on the implants themselves, you'll notice that that area right there on her lower left tooth is not really an ideal spot for any occlusion should be taking place. Any type of biting should not be taking place on this part of the tooth. And especially on the back here, this all should be gone, right? So she's got very heavy contacts on her front teeth and contacts on implants in improper positions. This is not a dentist problem. So this is a question I get all the time. The dentist is going to fit the teeth to wherever they need to go. So the dentist is trained to put the teeth in the position that they're supposed to be based on the other teeth that are around it. This isn't a dentist adjusting problem. This is a bite problem that the patient has that's been undiagnosed and needs to be properly treated in order for us to get the best possible result. Because if I did an implant, or I did a crown, or I did a root canal, or I did filling in this environment, the patient is most likely going to break it down at a much faster rate than if everything was in balance. Now here's the problem. If a patient has these types of symptoms and these types of issues, implants hurting, teeth that are constantly breaking, and you look at her smile, you might say, well, her bite looks good. Her smile looks good. It's exactly the way that she wants it. The problem is the bite is not in harmony with the muscles and not in harmony with the joints. And whenever you get those three things to not work together, the bite, the muscles, and the joints, whichever part is the weakest, and for her it's the teeth, will be the part that breaks down. And so you'll see teeth breaking, you'll see multiple implants. And every time we do a single implant for this patient, we're still just putting it into a bite that is basically pathology. It's a bad bite. And so just putting the implant there isn't necessarily going to do anything other than give her another tooth to chew with, but everything else is breaking down around it. So these are the kind of cases we actually have to take a step back, and we need to figure out, where is the bite supposed to be? And that's why we use an occlusal orthotic. So this patient will be wearing a full-time occlusal orthotic to actually figure out where her bite should be in space, where her bite matches with her muscles and her joints, so that she no longer has these weird areas that she's putting too much pressure on and breaking teeth. Okay, she's going to feel a lot better. Her muscles are going to relax. Actually, a lot of times we call this like a natural facelift, because faces tend to not, once the muscle tension is gone, the face looks younger. So there'll be a lot of benefits here. But we're seeing this at the tooth level. We're seeing that there's issues with the bite itself. Implants, you shouldn't have 4, 5, 6 different implants at different times because a tooth broke and now you need an implant. That in nature should not happen. It happens all the time, but in nature, if everything was the way it's supposed to be, you wouldn't see teeth just breaking over time from chewing, right? So when I see this, this is an immediate red flag to me. The other thing I want to point out is just the shape of the teeth. Teeth have a certain size and dimension to them. And so if we take the bite marks off and I look at these top teeth, okay, teeth are too short. There's too much wear on these teeth. They're not long enough. You can look at the front teeth. These teeth actually have a little bit of a curvature on the back, but the teeth aren't long enough. In every one of these teeth, if you look closer, you'll notice they have wear patterns on them. Okay. So what's really detrimental about this case over time is that as these back teeth continue to wear out, it puts more stress on the front teeth, and guess what happens to the front teeth over time? They break, they chip. Anything that's put on there, veneers, crowns, they will also break and chip. So we need to really be looking at this comprehensively. This is a very complex case. Okay. So just kind of going over again what we're seeing. We're seeing implants that are bothering her, red flag. Teeth that are too short, red flag. Some muscle tension, the way that she's biting, the occlusal marks on the teeth, way too heavy in the front, way too much stress patterns here. This is not good, right? So we need to take a step back. We actually need to figure out, where is her bite supposed to be? Now, in future videos, I'm going to talk about that. You've seen some of my videos about occlusal orthotics versus nighttime night guards. We're going to put this patient into an occlusal orthotic. And basically what we're doing is we're covering the top part, the biting surface of her top teeth, and we're adjusting it in a way to get her teeth to hit the way they're supposed to. When that happens, her muscles relax and her joints reposition themselves. And through a series of adjustments, we actually get her joint to see where it's supposed to. Her muscles are relaxed, and then we can take the orthotic out, and we can see how much discrepancy there is in the bite, and then we can add material back to the mouth to make her bite in line with the muscles and the joints. And I'm going to go through all of that process through the series of videos that I do here on this YouTube channel. But that's in nuts and bolts kind of what we do. We have to balance everything. We have to stabilize everything. Then we have to figure out how to get the teeth to fit back together again. And then we do it in a functional and aesthetic way so patients are happier with their teeth when they're done. Okay? So let me just show you, just very briefly again, just to summarize here. So I'm going to take these occlusal marks off. These are the things that we were looking for here. And I'm going to try to draw on this. Okay? We're looking at the shape of the teeth. Oh boy. I've never done this before. Shape of the teeth, too small. Okay, these premolars are too small, so that's telling me that there's a lot of tooth wear because now the teeth anatomically are much too small in comparison to the rest of her teeth. Okay, they should be more in line with this molar. So if I look at an occlusal line there, and then I'm going to look at an occlusal line there and over here, you can see that they're stair-stepping up. There's going to be a little bit of that just naturally, but there shouldn't be this much. Okay, so I'm going to get rid of those. Let me go back to normal pencil color. Is there a way to erase this? Yes. Okay, teeth are too short, and then if I rotate on the top teeth again, okay, all right, now we're going to rotate top teeth again. We looked at these implants. I'm going to rotate here, and I'm going to draw here. So we see, sorry, let me draw it in orange. Implant. Implant. Too many implants. Okay. We look at the bottom. Again, let's look at the bottom teeth. We're going to take the top teeth out. We're doing it on an angle. So now we're going to draw again out the implants. Implant. 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 I actually think that that's an implant. I can't tell definitively, but I think that one's an implant as well. Okay, just based on the scan. So we now see 4 implants on the bottom, at least 3, probably 4 implants on the bottom, and they're starting to bother her. Okay, so we have these telltale signs. So it isn't always necessarily that the patients have headaches, muscle pain, joint pain. That's where we see a lot of the symptoms that patients will discuss for me. But there's some hidden symptoms that we see that makes me think, okay, there's a bite issue going on here. Implants that are bothering her, teeth that are way too short, too much stress, the bite marks themselves way too heavy in the front. All of these things are signs and symptoms that something is not quite in balance here. And to go through another round of teeth straightening or orthodontics or Invisalign or more crowns and root canals, if we do any of that without figuring out where the teeth are supposed to go to begin with, it's kind of like driving on a road without a map. It will not work very well. It's not going to work for this patient. So we have to take a step back. We have to put an appliance in. We have to figure out where her bite is supposed to be. And as we go through that journey, we're going to be documenting this case actually quite a bit. You're going to be seeing this in real time as we stabilize the teeth, as we figure out where the teeth are supposed to go, and as we add to the teeth. So hopefully you got value from this video. If you are suffering from any of these symptoms and signs that you're seeing in these videos, please feel free to comment or reach out to our office. I'd love to be able to help you. Even if you live out of state, we do have patients that come in from out of state. We're able to help them at least feel more comfortable, better, and we can stabilize and we can restore patients as well. It just takes a little bit of effort on both of our parts, but it can be done. I've done it before. And as always, guys, thanks so much for tuning in to the channel. And if you want to see me post any videos in specific that you have signs or symptoms and want me to discuss, I'd be happy to do that as well. So take care, guys, and I'll see you at the next video.